I most certainly didn't wake up that morning and think that there's a possibility that I'll be shot today.
I think it's absolutely necessary to be prepared to deal with an active shooter scenario. We all hope that it would never happen to us, but we have to be prepared if it does happen.
It makes you think in ways that as you've grown in your life and your profession that you hoped you'd never have to think about.
We need to come into our jobs every day knowing that there is a high risk, it's a high risk environment for injury.
You walk into a healthcare facility, it is a microcosm of your own community.
We have to start closing some of these environments in a way that keeps the mission of the hospital in mind, but we are also keeping people safe.
Many of the things that happen outside of the hospital are going to be magnified in a healthcare facility.
The best way to really predict who's going to be violent, who's not, if they happen to be in your environment, is your gut level feeling.
Attention, Chardon Rescue. We have an active shooter. Repeat, active gunshot.
Well, the call came in about 2:30 in the afternoon to the operators that there was a man with a gun on the 8th floor of our tower building.
The gentleman was holding a gun on my colleague, and she was frozen. The fear of God in her eyes, and there was another staff member, kind of the same scenario.
In actual shooting situations, people tell us it feels very often like a dream or a movie. It seems so unreal, and the first reaction many people have is disbelief.
Within 15 to 20 seconds, multiple calls were coming in now that shots were fired, so we knew what the location was. We had a supervisor and 2 security officers who were dispatched to the floor. They responded from the first floor of the tower building, and they arrived literally probably within 60 to 75 seconds from the first call.
If somebody's holding a gun at you, you don't want to stand facing them with your vital organs exposed. Best to turn sideways. Just turn sideways so your rib cage is smaller that way than it is out here, and you also have your arm to protect yourself.
People, when they're faced with these type of situations, and you can talk about it being a moral dilemma, whether you're going to stay with your patient.
There'll always be moral and ethical dilemmas in what you're going to do. However, if you know the best thing to do, the best way to make patients safe, to make staff safe, you're more likely to do that. Certainly more likely to do that than if you don't have the training.